Good evening. I'm Dr. Jen Sullivan. I'm a pediatric emergency medicine physician and the Secretary of the Indiana Family and Social Services Administration. This is a cabinet level position in Indiana that helps to deliver social services to 1 in 4 or 5 Hoosiers every day across the state. It's really an honor to be with you today. What I do want to talk to you about today is my experience at the Honors College and share a few reflections and thoughts that I hope as you begin will be helpful to you as you look forward to the rest of your life. On this day in 1992, an 18-year-old kid from Indiana was listening to the fall convocation at the honors program at the University of Houston. It was a long way from home by design. It was time to get out of small town Indiana, and big city Texas changed this young woman's life with a single phone call and a National Merit Scholarship. During the keynote address of that convocation, then Dean Ted Estes, who would soon become a friend and mentor, said a couple of things. 1, we are here to protect society from you, not the other way around. They are not ready for you yet. You are dangerous. Number 2, no matter what you do here, remember first, you are a student. Over the next 4 years, the impact of the honors program, now college, was immeasurable. The faculty introduced me to opera, ballet, poetry readings with Sherry, indie movies, the rodeo, travel, and ghost peppers. I fell in love with the Galleria water wall, backpacking, Maria Rainier Rilke, Georgia O'Keeffe, Mary Oliver, Flannery O'Connor, Willa Cather, and a Ukrainian water polo player who spoke French and then broke my heart. I took classes in physical chemistry and German women film directors and played the French horn in the orchestra. I backpacked through Europe for 3 months and learned while hiking the mountain to see the Oracle of Delphi that the physical manifestations of the word epiphany are actually feeling a weight in your chest and a need to laugh, cry, and dance all at the same time. And by the time 4 years passed, I was transformed. Not a different person, but as Dr. Estes said, ready for society and poised to always be a student. Not metaphorically, but literally for the next 12 years. Mixed in all of this discovery and academic growth, there's a singular moment that I would like to tell you about that is responsible for what I do today and why I do it. It is the crux of what I want to tell you today. You'll only remember one thing, maybe, and this should be it. I have known since elementary school that I wanted to be a doctor. Unfortunately, I also had no idea what I was talking about. The fact that I actually am one and have been for 20 years is still a bit shocking. When I got to U of H, one of the first things I did was start volunteering at St. Joseph Hospital, right down the street from campus. I worked on Saturdays in the neonatal ICU and fell in love with medicine, the people, the patients and their families, and the stories that unfolded before my eyes. I started to push the boundaries of being a volunteer and was encouraged to take additional classes to be a NICU tech, which I quickly did. After that, the world opened. Our weekend team of nurses, respiratory therapists, and the neonatologist had seemingly unending patience with me, teaching me constantly. One Saturday morning, the fall of my sophomore year when I was 19, the morning started in a very unusual way. We got a frantic call that a baby was coming up from the ER with active CPR happening. He came into our resuscitation room, and the first thing I noticed was that he was big. We didn't have full-term babies in our NICU, and this kiddo was gorgeous, and he was big, but he was also dying. His mom, who was also 19, just like me, had not known she was pregnant and delivered him in the toilet. What followed was a well-run but unsuccessful attempt to resuscitate the baby. The moment where I watched our neonatologist deliver the news to his mother, who had only known of his existence for a few hours, and now he was gone, changed my life. This woman was 19, again, just like me, and her life had just been changed in a different way forever. I stood frozen to the floor, thinking about all the opportunity that awaited me through no singular accomplishment of my own. I had 2 supportive parents, a great public school in a small town, a full scholarship to a university, the opportunity to work, and my full health. I had no adverse childhood experiences and I'm white. The chasm that divided this young Black woman in an urban environment from me in this moment became my motivation. I didn't know how to fix it, but I knew I had to be part of the process to try. Taking Dr. Estes' words to heart, when I graduated from this program, I went to medical school at Indiana University, then 5 years of residency in emergency medicine and pediatrics, working through the lens of clinical medicine to try to make a difference in individual lives. This is a noble profession, but it wasn't yet enough. I needed another language to tackle the chasm that manifested itself every single shift in the emergency department and reminded me of that young woman's face. I found it in public health, and specifically in the science of social determinants of health and how the unmet social needs of people, their families, and communities have more impact on health than any healthcare intervention ever could alone. Let me explain. Doctors are really good at writing prescriptions for albuterol, when we should also be able to write a prescription for a smoke-free car for someone with asthma. Operating on a patient with a gangrenous foot from frostbite might solve the immediate problem, but without securing housing, the underlying condition will worsen. And in isolation, our typical standard of medical intervention may actually contribute to that global worsening. We also know that race and ethnicity have an impact on health outcomes, in part due to long-standing systems and policies that have contributed to racism in both human services and healthcare. What does this have to do with starting the next phase of your life at U of H? Everything. The education and experiences that start today set you up for wherever you might find your career taking you, and the lens that you can be part of filling the chasm that exists between you and others who need you to amplify their voices. My career path has been unique and definitely unpredictable, but the skills that started here at the Honors College were honed in medical school and during my residency training, furthered as an educator and researcher, and then catapulted forward in public health. Becoming a public servant was definitely not written in my mission statement, but leading the agency responsible for delivery of human services for the last 3.5 years is the most challenging and fulfilling thing I have ever done. The additional strain on our services during COVID has allowed us to hone our organization in the fire of crisis management, knowing that our supports like Medicaid, SNAP, which supplies food, TANF, which is cash assistance, mental health and addiction services, disability programs, and childcare, had to be flawless to support Hoosiers from the downstream effects of a public health response. My crisis leadership required just as much poetry as it did science. The critical thinking, communication skills, and the ability to notice things happening around you do not happen automatically. They must be learned, practiced, and embedded into your DNA. These skills translate across the entirety of how you will interact with the world. The responsibility that comes with an honors education is that each of you will be equipped with these broad skills to make a contribution to the improvement in the human condition. I bear that weight and live in awe of being given this opportunity. I have a special message for the engineers and physicists and chemists and mathematicians in the audience. You have a special place in my heart. In order to change the world, you must be able to write and speak to the public. The translational component of your work to the public is now a critical part of behavioral change. With misinformation and science denial in abundance, hone your craft and your ability to communicate it to the world. Despite these dark and uncertain times, my hope for your future, for our future, remains steadfast because the treasury of knowledge is awaiting you here. Dr. Estes said college students are dangerous and should never stop learning. Those things are still true today. Willa Cather said in O Pioneers, there are only 2 or 3 human stories, and they go on repeating themselves as fiercely as if they had never happened before, like the larks in this country that have been singing the same 5 notes over and over for thousands of years. One thing is different now. Society is ready for you because you are dangerous. Not only are we ready, we need you and your voices. Write a story that hasn't been written. Prove Willa Cather wrong. It's time. It's the first day of the rest of your life. Make it count. Go Cougs.